Today we're going to talk about blood flow restriction, also known as BFR, and some of the considerations that you should take into account when considering this treatment. Hey everyone, this is the Pragmatic PT, and as always, this video reflects my personal opinion based on my own interpretations of the literature. This video is intended to be a source of information and not medical advice. If you are currently dealing with an injury, I highly suggest you seek help from a qualified medical professional. So what exactly is BFR? Well, BFR is a technique used to restrict blood flow to either an upper extremity or a lower extremity. So this involves taking a band or a blood pressure cuff and placing it around the upper arm or the upper leg. Now what this does is it restricts venous blood flow from exiting the extremity, as well as partially restricts arterial blood flow, so that's blood entering the extremity. Why exactly would somebody want to do this? Well, this restriction of blood flow creates an environment that is ischemic. And what this does is it creates metabolic damage that results in greater hypertrophy to the muscles in that area. So the idea is that we can lift with much lower loads, creating a metabolic damage in the tissues, increasing the muscle hypertrophy, so that is the growth of the muscle, the cross-sectional area, and this has been proven to be effective when we're volume and load matching. So that is, when we do BFR at a specific load of an individual's 1RM, and we compare that to doing the same load for the same repetitions without BFR, the BFR group has an increase in muscle hypertrophy or muscle growth. Now that we know a little bit about what BFR is and how it works, who exactly is the individual who should consider using BFR? In the rehab setting, that would be somebody who doesn't handle loads well, who is recently post-op. Say, for example, an older individual who has some knee issues and struggles with loading their knee very heavily, or that post-op patient who just had an ACL reconstruction, for example, and is contraindicated from lifting heavy loads due to the time from surgery and the health of that graft. Another population that would benefit from BFR is that population who's just looking to maximize muscle hypertrophy or muscle growth. Now, this population can have overlap in the rehab world as well as in the fitness world. As we know, muscle mass and hypertrophy can be useful for both a post-op patient or an older individual who's trying to stay healthy and strong. Up to this point, BFR looks pretty promising, and it quite honestly is. So what are some of the reasons why we might not want to use this treatment? Well, the first is the time and attention that's required to use it. When using this treatment in the rehab setting, we're generally taking the individual's blood pressure to determine what their systolic pressure is, so that a cuff can be placed to reach a certain occlusion of their arterial blood pressure. Although this is pretty simple, it does take a little time and attention from the clinician. Another consideration is the comfort level of the patient. BFR isn't exactly known to be the most comfortable treatment, as that cuff being placed on the arm or the leg can be pretty tight and does create a pretty solid burn in the muscle due to that lack of blood flow to the area. Another reason why you may not want to use BFR is if your patient can actually handle heavier loads. And our final consideration would simply be that if hypertrophy isn't the goal, maybe BFR isn't the best option. Now that we've looked into some of the considerations, let's expand on that a little bit. So the first thing I want to talk about is muscle hypertrophy. Now, hypertrophy is the increase in cross-sectional area of muscle and is generally seen as one of the primary goals of strength training. Muscle hypertrophy, for the most part, seems to be volume dependent. So basically what that means is as long as you do the same amount of work, so that's the same pounds lifted over a session, your muscle hypertrophy should be relatively the same. So regardless of whether you use heavier weights for low repetitions, or you use lighter weights for higher repetitions, as long as the entire amount of weight lifted in one session is the same, your muscle hypertrophy should be relatively the same as well. So what this means is the resistance that's used is less important than the total volume of weight lifted in an entire session. This, however, is only true to a certain point, as we don't see the same hypertrophic gains when lifting weights that are 20% of a 1 rep maximum. Another point to consider when maximizing hypertrophy is that hypertrophy does not equal strength. Although hypertrophy is a factor in overall strength, as we see those with the greatest cross-sectional area of muscle mass tend to have the highest potential for strength, the sheer fact that you have more muscle mass doesn't mean that you will also be stronger. So let's go ahead and talk about strength then. Well, in the process of developing strength, this does require higher loads to be lifted. So when we look at studies comparing low load strength training versus high load strength training, it's pretty clear that the higher load strength training increases the amount of strength that is gained by the participants. This can also be seen when specifically looking at BFR studies, where they compare low load strength training with BFR to higher load strength training without BFR. Muscle hypertrophy tends to be the same between the two groups, but strength improvements are significantly higher in the high load training group. So although BFR can be incredibly useful for those patients who we want to maximize muscle hypertrophy, we aren't exactly getting the same amount of strength benefits that we would from higher load strength training. This brings us back to the idea that muscle size and strength are independent of each other to a certain point, and that strength in general is a very valuable quality for all populations to have. Now, when considering to use BFR, we have a lot of things we can take into account, so it becomes less clear whether BFR is something you should do or not, and that's quite honestly the purpose of this video. I'm not here to tell you whether or not you should use or not use BFR, but just to give you some ideas to consider when thinking about this treatment.